Well, hello. Welcome, everyone. It's been fun seeing you enter your names and see so many familiar faces and not faces, familiar names in the chat. Welcome. My name is Julia Isaacs, and I'll be serving as your moderator for this webinar. Do longer eligibility periods lead to more stable care for kids? This March 23rd webinar is the first in a series entitled Measuring and Supporting Policy Changes, Lessons Learned from CCDF Lead Agency Research Partnerships. So next slide. As a housekeeping matter, I want to let you know that this webinar is being recorded. We will post the slides, the recording, and the transcript on our website a few months after the webinar. Also, we have enabled closed captioning. That will make the webinar more accessible. You can use that live transcript button at the bottom of your screen to show or hide the captions or adjust settings. So we do have more than 300 people registered. I can see quite a few attending, which is wonderful. But with that number of people, we have muted you and your cameras are hidden. But we do want to make this interactive. And so I've invited you, and many of you have responded putting in who you are in the chat, which is wonderful. Also, you can type questions or comments into the chat box at any time, and we will be collating those and getting a chance to answer the questions. We'll probably have clarifying questions just after each presentation, and then more time at the end for discussion with our panelists. And at that time, we'll pull questions from the chat box, and you also at that time can raise your hand, through the Zoom reactions button for the closing discussion. So next slide, I do want to let you know that we're bringing you this webinar. We are the Center for Supporting Research on CCDBG Implementation. The center is supported by the Office of Planning, Research and Evaluation, OPRE, and the Administration for Children and Families. And it's managed through a contract with the Urban Institute. I'm Julia Isaacs, a senior fellow of the Urban Institute, and I serve as project director. And as I said, we'll be moderating today's webinar. I'd like to give a shout out to Alicia Blandon, our project officer. I also want to thank my colleagues who are there behind the scenes help. Teresa Derrick Mills, who's our deputy project director, Laura Wagner, our project assistant, and you'll also hear me communicating with Ivy Hunter of Urban's event team. So our center's goal is to support CCDF lead agencies, support you in building your research and evaluation capacity. We're particularly focused on evaluating the implementation of the CCDBG reauthorization. And we do this through things like this web event. We also have a number of written briefs on our website. And Laura, if you could put the chat in the link in the website, it's the Building Child Care Research Capacity website, which you also could just Google. And one of our activities has been supporting. There have been different CCDF lead agency partnerships that got grants called CCDBG Implementation Research and Evaluation Planning and Implementation Grants. That's a mouthful. We've been supporting those grant teams, and 3 of them will be featured in this webinar. Okay, next slide. So what are we going to cover today? Our topic is child care stability. Chris O'Grady, who is the CCDF lead administrator in the Oregon Department of Education, will provide some motivation for the topic. Then I'll come back on and give a little bit of background about some research terms and definitions related to measuring subsidy. And then the heart of our presentation will be some emerging findings from Oregon, Massachusetts, and Illinois. And finally, we'll have time for questions and reactions. And we really do want to hear from CCDF lead agencies in particular, and I'll ask Chris to jump on then and to kick us off, but then I want to turn to all of you, but don't wait till the end for your questions. Feel free to put them in the chat and we'll be collating them and be ready for that. Another way what we want to hear from you is through interactive polls. So Ivy, could you bring up the first poll? I'd love to know who is here today. So in this poll, you can see Are you state or territory CCDF lead agency staff, tribal CCDF lead agency staff, external researchers, technical assistants or TA providers? Do we have some of our friends from the federal staff? And we have others, different categories. I'll pause, just let you a few more people fill it in. Okay, Ivy, you want to share those results? This shows that, wow. Well, you know, our target audience was CCDF lead agency staff. I'm delighted that 45% of you are with state or territory CCDF lead agencies and 9% from tribal CCDF lead agencies. That's really exciting for us. We're also delighted that 20% of you who are external researchers, many of whom work with the CCDF lead agencies, the federal staff who also are very interested in these findings, TA providers who also support CCDF lead agencies, and those of you in the other category, glad you're here too. Let me now turn it over to Chris O'Grady. Chris holds the position of Child Care and Development Fund, or CCDF, Fund Administrator and Child Care Policy Analyst for the state of Oregon. She's located in the Department of Education. Chris has a law degree and is an enrolled member of the Monacan Indian Nation. As CCDF Administrator, Chris engages with various community and research partners to develop child care policy at the state level. Over to you, Chris.
Thanks, Julia. Childcare subsidies are a vital support to families in Oregon, and not just for families with children 0 to 5, but families with school-age children as well. Before Oregon had many of our early learning and care programs that are funded with state money, the subsidy program, which we call the employment-related daycare program, was the main source of support for care. At the policy level, we know that multiple changes in care arrangements can result in negative impacts on a child's development and family stability. And it's our job as the lead agency to create a strong program infrastructure to prevent that. Before the reauthorization of CCDBG, a family's eligibility only lasted between 3 to 6 months in the program. Families participating in ERDC usually have work schedules that constrain the types of care that they can access. So when they can find a provider, it's important that they're able to maintain that support. Reauthorization allowed us to move to a more protected 12-month eligibility period, which created a window for more stability for children and families, which Oregon State University will talk a little bit about in their presentation. And while we have seen that this has slightly increased subsidy spells, there's more to do. And given the state of childcare because of COVID-19, the state is assessing how to leverage the framework of CCDB reauthorization and research on impacts to create a stronger subsidy system for children, families, and childcare providers. And then Julie, I'll hand it back over to you.
Thanks, Chris. I appreciate your joining us in what I know is a busy day for all of us. Thank you, everyone, for joining us. I know you all want to hear the preliminary findings from Oregon, Massachusetts, and Illinois, but with the next slide, I just want to cover a little bit of the research terms we're going to be using to make it easier to follow when the presenters talk. The basic question all three presentations are going to ask is, do we expect more stability after the CCDBG reauthorization policy changes, and particularly that change to a 12-month reauthorization period? To answer this, we basically ask, do we see longer spells for eligibility periods, subsidy spells, or time with provider? When I say spell, I basically just mean the amount of time that a family is in an activity. So eligibility period is the time period the family's authorized to use the child care subsidy. Now, in your state, you might call that the eligibility period, the authorization period, the reauthorization period, the redetermination period. Those all basically mean the same thing. You might think, well, of course, it's 12 months. That's what the federal law says. Well, there may be exceptions for some families. Your state policy may be a little different. Your computer system, the way your caseworkers implement it. We have to see if there really is a 12-month authorization. But the more critical question, which all three studies will look at, is what's the actual amount of time the family uses the subsidy? They may be authorized for 12 months, but maybe they only use it for 3 months. And this will be our main measure of subsidy stability. And then one of our three studies, the last one, Illinois, will go one step further and say not just what's the subsidy length, but how long is the child with the same provider? And that's where we really get at the continuity of care, looking at the children's experience with provider. Now, in the next slide, I'm going to say a little bit about how we measure subsidy spells, because all three, the next slide, all three presentations use the same basic methods. So to measure subsidy spells, which is basically means the length of the time that the children receive the subsidy, to do that, you have to link together all the program records for thousands of families, unless I guess you're a very small program, but as many families as are in your state, tribe, or territory. For each family, you measure when the spell starts, you measure the duration, which means until the family stops receiving, until it exits subsidy. You then have to compare two groups of families. All those that came on before the policy, how long are their spells? And all those that came on after the policy, how long are their spells? To compare the groups, you'll need like a summary measure. We don't really use average, we tend to use median. And if you remember what median means, it's the midpoint. And so if you lined up all families from the shortest spells, those that had maybe only on for 1 month, 2 months, and the longest spells, this family that's been getting it for, I don't know, 30 months. The point at which the middle would be a median, maybe 8 months, maybe 12 months, depends on your state. The other thing I will say briefly is that we will talk about something called duration analysis. It's a branch of statistics that's sometimes also called survival analysis. It's a little bit complex, but basically you'll see this in each of the three presentations where they graph. We often show this in a graph, like 100% of the families are on at month 1. And then after 2 months, maybe 80% are still on. After 8 months, maybe 50% are still on. And then there's a few that are still on sort of for a very, very long time. So you'll see a lot of these curves. And we're showing them because they're so common in duration analysis. We think that after you've seen 3 sets of curves, it will feel a little bit less confusing, but we aren't expecting, I don't think I could do a duration analysis. It's quite complex, but we want you to see how to sort of read them. And if you want more information, all of these 3 studies are different, but they're using common methods. And those methods are explained further in the report, Common Challenges in the Study of Continuity of Child Care Subsidy Participation, which is by Davis, Groby, and Weber, 2012. Now, I have one more introductory slide, next slide, before we'll turn to the presenters. Looking back at 2014, when the federal law went into place, what were the eligibility or redetermination period policies for states? Well, this map shows that almost half of the states and territories, 24 to be exact, had a 6-month redetermination period for most families. Now, this includes Illinois and Oregon, who we'll be hearing from today. Now, when you go from 6 months to 12 months, that is a pretty large change. One state had an 8-month eligibility period. And then the remaining 31 already had a 12-month eligibility period for most families. But still, there was a change for some families. So in Massachusetts, which is one of the states we'll be hearing from, while there wasn't a change for most families, there was a big change for the group of families that gets child care assistance, but also gets cash assistance under the TANF program, Temporary Assistance for Needy Families. And so we'll be learning about more what happened to the TANF families when we get to hear from Massachusetts. Now, let me just say that these policies, I pulled this map from the CCDF policy database, which is maintained by some of my colleagues at Urban. And I'll ask Laura, oh, she's already dropped into the chat, information about the database and its link. Okay, Enough background. It's time to hear from our three experts. Why don't you pull up the next slide, Ivy? Our first speaker will be Megan Pratt, who is an assistant professor in the College of Public Health and Human Sciences at Oregon State University. She leads the Oregon Child Care Research Partnership. And as many of you know, there's a long history of great research coming out of this Oregon partnership. Megan serves as principal investigator on the CCDBG Implementation Research and Evaluation Cooperative Agreement, leading a study called Evaluating CCDBG in Oregon, Impact of the 2014 Act on Children, Families, and the Quality of Home-Based Care in Oregon. So she'll just share some emerging findings from that study. Take it away, Megan.
Hello, thank you, Julia, for the introduction, and I'm very happy to be here and share with all of you some results from our study, one of our studies, a part of this project, using Oregon's administrative data, looking at family subsidy stability in Oregon before and after reauthorization. So next slide, please. So our research question for today is, did the implementation of 12-month reauthorization with 3-month job search policy improve stability for child care subsidy participating families? As Chris described earlier, Oregon has a history of fairly unstable subsidy participation for families in the state, making this a really important policy to evaluate. Oregon implemented the 12-month reauthorization and 3-month job search policy during federal fiscal year 2017. And it's notable that there were other policies related to CCDBG reauthorization put in place during this year as well. One of those being background checks and home visiting requirements for non-regulated license exempt providers in the state, which is our friends and neighbor type care. And for today, however, the 12-month reauthorization and 3-month job search policy and that focus on the family experience of the program is what we're looking at today. So next slide, please. So in this study, using administrative data, first I want to note that we're focusing on employment and income eligible families separate from TANF. In Oregon, the TANF Child's Care follows a different set of policies and does not have the 12-month eligibility. And so we're focusing on what's called employment-related daycare in Oregon. And so we wanted to compare families' experiences before and after the policy change. So to evaluate family subsidy spells, so how long they were on a subsidy before break in use of the program, we used a 5-year time frame. Since the research question is looking to address that impact of the policy, we wanted to do what we could to ensure our post group includes those that we have confidence that their behavior was influenced by the policy. So to do this, the 2 years before the policy change, federal fiscal years 2015 and 16 is what we're calling the pre-policy group. These are families that started spells in either of these years. Then the 2017 year, we are conceptualizing as the implementation year. So this is when the 12-month policy was put in place. And we think about it as a transition year, as it's really unclear where families started. So the data from this year are not included. And then we looked at post-policy change. And so this sample is those families who started their spells in either 2018 or 2019. Next slide, please. So before diving into the analyses of stability, we took a look at the demographics of the families who participated in the pre-policy period and the post to see how comparable they were. And overall, the sample generally looks similar. Nearly all families were headed by single parents, predominantly mom. There was an average of just over 1 child in each household. In both samples, pre and post, 1 in 3 families reported having a child of color. They reported on that. And 1 in 7 lived in a non-metro county. One area where there were some differences between the pre and post families was in the distribution of the age of children served, with those participating in the post period having more infants and toddlers and fewer school-age children. In future studies, we will be exploring some of these differences between the composition of those in the pre and post groups, and also looking at other things such as employment. So let's go ahead and dive into what we found. Next slide, please. As a reminder, the question was, did the implementation of the 12-month reauthorization with 3-month job search improve stability for child care subsidy participating families? And so with that duration analysis that was described earlier, what we found was that the median spell length, or the number of months at which half the families had a break in their subsidy usage, was 7 months in the pre-policy period and 8 months in the post. So this is a fairly modest increase. Next slide, please. So this is another way to look at the results. And this slide looks quite complex, but I'll tell you what to pay attention to. So the figure shows that this is the figure, is a survival curve for the pre and post periods. So what's notable here is that the solid curve line and the dashed curve lines are following a similar path before and after those median spells, which are noted with the 7 and 8 and the circles around those. This maps onto the slide right before. So the takeaway from this slide is that although there were slightly longer spells in the post period, the two curve lines are not very different at all, and in fact, nearly overlapping in a few places, suggesting there was little difference in the family experience of family stability using the program pre to post policy change. Next slide, please. So why didn't Oregon see more stability for our families in Oregon after the new policy implementation? And I'll highlight 2 explanations. First, we know that policies interact, and it's very hard to draw a direct line from a policy to an outcome like stability, especially in cases where there's multiple policy changes and other contextual factors at play, like budget. Second, there's also often a lag between a policy change and changes in practice, and also parents' understanding that of how a program works and parents' subsequent behavior. So it's possible that parents did not understand they could continue using the program during that 3-month job search window. In a recent qualitative interview study that we conducted about barriers to the program, parents did report concern about losing access to the program or having to pay money back if they used more hours of care than they were approved for, or used care to cover something other than those hours of employment that they have. These are concerns that could be contributing to them not using 3-month job search, even if they understood the new policy. So this is a good place to stop and will lead to the next presentation, which illustrates how one state went about examining how the 12-month reauthorization policy was implemented into practice and how that worked out in their state. So next slide, please. So thank you. Please feel free to add any clarifying questions and comments into the chat, and I'm going to provide the following acknowledgement. So thank you. This project is supported by the Administration for Children and Families of the United States Department of Health and Human Services as a part of Financial Assistance Award Grant Number 90YE0200, totaling $961,410, with 100% funded by ACF HHS. The contents of those authors are those of the authors and do not necessarily represent the official views of nor endorsement by ACF HHS or the US government. For more information, please visit the ACF website, Administrative and National Policy Requirements. And I'd like to acknowledge that this study was completed in partnership with the Early Learning Division, Oregon Department of Education, and would like to acknowledge our partners at the Oregon Department of Human Services for their support and invaluable insight into this work. Thank you.
Well, thank you, Megan. And I do have a clarifying question for you. When you're looking at those spells, the median spell going from 7 to 8, could you say what you're measuring? Is that the authorization month? Is that a payment? Are you looking at attendance records? What data are you looking at?
Thank you. That's a great question. I'm happy to clarify. So those results are coming from our state administrative 801 data. So they're tracking the payments. So they're the usage of the program, and specifically is indicating that there's a payment to a provider in that month, and a break we defined as at least 1 month without a payment to a provider.
Thank you, Megan. I appreciate the question and I appreciate your answer. I think we will go on to the next presentation, but we also will continue to send in your questions. We do have more time at the end. If I get the next slide, we're going to turn to Massachusetts. And I'm happy to introduce Dr. Kate Giappone-Schneider. Kate's a research scientist at the Institute for Child, Youth, and Family Policy at Brandeis University. She has more than 15 years experience doing childcare subsidy policy research and consulting, with a focus on making research useful for programs and policies at the state and federal level. She currently serves as a co-principal investigator on 2 OPRE research grants. I think you'll find the Massachusetts study interesting because Kate looks at the implementation of policy and how it differs in different regions of the state.
Thank you, Julia, so much for that introduction. And thank you all, everyone. I'm so excited to be here with all of you today. My title of my presentation is Improving Childcare Subsidy Stability Through CCDBG Policy Changes for Massachusetts Families Receiving TANF. And again, I'd just like to take a brief pause here to also acknowledge my research partnership team, Pamela Joshi from Brandeis University, Yunsa Ka from Boston University, who will actually also be on the Q&A session later, Wendy Wei from Harvard University, and Jocelyn Bone from the Massachusetts Department of Early Education and Care. Next slide. So again, like Julia said, our study focuses on evaluating CCDBG policy changes in Massachusetts and the effect of these changes on subsidy stability for TANF families. And we focus on TANF families because research has shown that these families experience more instability of subsidy benefits compared to low-income working families receiving subsidies. So now let's talk a little bit about the policy changes. Before Massachusetts implemented the CCDBG policy changes in October 2018, the state issued 3 to 6 month subsidy authorizations for TANF families. And the length of the authorization was tied to the work activity that the parent was involved in. So for instance, if a parent was involved in a 3-month work training program, then they'd be issued a 3-month subsidy. So this means there were frequent client visits to get subsidies reauthorized. Also, in this period of time, there were no short-term authorizations to help TANF clients search for a job or a work activity when they first entered the cash assistance program. So now, starting in October 2018, after the policy changes were implemented, Massachusetts started issuing TANF families 12-month standard authorizations. So that meant that that 3-month job training program that a parent was involved in that parent would get a 12-month childcare subsidy because those subsidies were no longer tied to the authorization length of the work activity. So that meant less frequent client visits for TANF to clients to go to TANF offices to get their childcare subsidies reauthorized. Also, under these new policies, Massachusetts started to issue 12-week subsidy authorizations to help TANF clients search for work activity while still receiving care. Next slide, please. So a little bit of background information. In Massachusetts, there's 2 separate systems for TANF and childcare subsidies, and these 2 separate systems are both responsible for administering childcare subsidies for TANF families. So what does that process look like? Once a parent receives a childcare referral from the TANF office, the parent then has to make an appointment at a childcare resource and referral agency, that is at a CCR&R agency. And that CCR&R agency is contracted by the state to verify documentation and then issue a voucher to that parent. So the transition point between these 2 systems is important to note because it could contribute to the instability of subsidy benefits. Next slide, please. So in terms of our hypotheses or what we expected that the new rules should help to increase subsidy stability among TANF families. However, we were also cognizant of the fact that the effects of the new rules could be offset by things like implementation challenges, existing administrative burden not addressed by the policy changes, and additional policies implemented at the same time. From previous work that we had conducted in the state, we also expected to see differences in the implementation of the policy by region. So for these regions, we not only examined administrative data on families receiving TANF, but we also went out into the field and interviewed subsidy administrators and parents. Next slide, please. So now let's talk a little bit about our study results related to implementation of the policy changes. First, we found that implementation of the authorization rules went fairly smoothly at TANF offices. One director indicated that her staff were in fact zealous in their implementation of the new rules and making sure that parents know about how the longer authorization periods and to understand that they had increased access to childcare. Many TANF staff actually welcome the changes, not only because they allowed children to have more stability of care, but also because it decreased parents' stress around childcare, in particular when there was a job loss or a change in employment activity. As one caseworker noted, parents love the 12 months because they're not so panic-stricken. The whole process is a lot calmer for everyone involved, so it doesn't seem like they're stabilizing crises all the time. However, there were some caseworkers who were less enthusiastic about the changes because they thought that it would be more challenging to hold parents accountable for meeting work requirements without tying childcare vouchers to a work activity. So as one director indicated, some have thought that childcare referral is the one thing we had to hold parents accountable for meeting their hours, and we could threaten to take the childcare away. So there's still some culture change needed for some TANF caseworkers. Next slide, please. The quantitative data also shows that there was successful implementation of the new policy changes for TANF clients, with subsidy authorization periods increasing after policy implementation. In fact, while the median authorization length was only 2.5 months in the pre-policy period, it skyrocketed to nearly 12 months in the post-policy change period. Next slide, please. So looking at policy implementation at the CCR&R offices, we found that the CCR&Rs had many more rules and more complex changes to implement compared to the TANF offices. In particular, there were many new rule changes for low-income working clients that were not easy to implement. This included the collection of documentation during the middle of a 12-month authorization period for families to report things like temporary changes in their work or income. While some of these changes did not directly affect TANF clients, it could lead to longer wait times for appointments at the CCR&Rs. As one director indicated, while we're seeing less clients in the office, we're overwhelmed by the amount of mid-authorization documentation coming in. It has eliminated the number of voucher counselors available to see appointments due to us having to set aside a day per counselor to keep up with the changes being reported. On a positive note, the CCR staff did report having fewer interactions with TANF clients, including fewer emails, phone calls, and in-person visits, because many clients just came in one time for their annual reauthorization appointment. Next slide, please. So now let's move on from policy implementation to look at the impact of the change on family subsidy stability. And this graph is again similar to Megan's. The graph shows how long TANF families tended to stay on the subsidy program statewide in Massachusetts. In particular, it demonstrates that TANF families tended to stay on subsidies longer after the policy change compared to before. The blue line with square markers represents the pre-policy change period, and the red line with circle markers represents the post-policy change period. And here you can see a big difference between the two lines, bigger again than we saw in Oregon. In particular, we see that 40% of families left the subsidy program by 7 months in the pre-policy change period, whereas 40% of families left the subsidy program by 13 months in the post-policy change period. And we can talk about this a little more in the Q&A, but I just wanted to quickly note here that unfortunately we're unable to report the median spell length. And that is, as Julia described, the number of months when 50% of families leave the program. And that's because unfortunately we don't have a long enough study period after the policy change was implemented. As you might imagine, this is largely due to policy changes that were implemented due to the COVID-19 pandemic. Still here, the key takeaway is that so many families were still on the subsidy program at 13 months. Next slide, please. So not only did we look at subsidy stability statewide, but we also examined subsidy stability by region. And we found that in some regions, families stayed on subsidies longer in the post-policy change period. So for example, families receiving TANF in Region 2 stayed on subsidies longer after the policy change compared to TANF families in Region 1. And although families in both regions exited the subsidy program around 7 months in that pre-policy change period, again, what we saw statewide, again, in the post-policy change period, Region 1 families tended to exit the program roughly 13 months versus in Region 2, they exited at roughly 15 months. So using our qualitative research, we found that administrative practices could help to explain the differences in subsidy stability across these two regions. In particular, we found that there were differences in whether the TANF office in each region issued 12-week authorizations. We found that the TANF office in Region 1 emphasized giving vouchers with 12-week authorizations to clients who needed more time to find a job or a work activity when they first entered the TANF Cash Assistance Program. Whereas in Region 2, the TANF office focused on getting clients into a work activity quickly rather than issuing these 12-week vouchers. So Region 1's focus on these short-term vouchers could have reduced authorization lengths in that region. Additionally, we found that in Region 2, where we saw longer subsidy durations or longer spells, the CCRNR was much more proactive in helping clients make the transition between the two systems, that is the TANF office and the CCRNR office. In fact, there was a dedicated TANF coordinator in the Region 2 CCRNR who called TANF clients once they received a referral, and that coordinator would then help that family make an appointment with the CCRNR and explain the required paperwork. The Region 2 CCRNR also co-locates staff in the TANF office so that after a parent receives a referral from a TANF caseworker, that parent can then just walk right over to the CCRNR staff member who can then process their voucher. In contrast, Region 1 does not call TANF clients when they receive a referral, nor do they co-locate at TANF offices. So Region 2's family-friendly practices could help to increase subsidy stability for TANF families even further than the policy change, again, compared to the Region 1's practices. Next slide, please. I think I'll end there. I look forward to hearing questions from everyone. If you have a question, please type it into the chat box. And while you're doing that, I also like to acknowledge that this study was supported by the Administration for Children and Families of the United States Department of Health and Human Services as a part of a financial assistance award. That's grant number 90YE0203, totaling $999,997 with 100% funded by ACF HHS. And that the contents are those of the authors and do not necessarily represent the official views of, nor an endorsement by ACF or HHS or the US government. For more information, please visit the ACF website at the Administrative and National Policy Requirements.
Thank you, Kate. I'm not seeing clarifying questions for you at this time. I did see a hand raised, and we'll unmute people in the closing discussion, taking questions in chat at this point. I think I'll go on to the next slide and to Illinois, but if you have questions for Kate, go ahead and put them in and we will get to them. So for our third state, we will hear from Illinois. I'd like to introduce Leah Gertson, who is a senior researcher at Chapin Hall at the University of Chicago. Leah's research focuses on the well-being of children and families using administrative data analysis, as you'll see, program evaluation, and survey research. She will share some emerging findings from the CCDBG implementation grant in Illinois, and will get us to look not just at the subsidy spells, but also how much time children spend with providers. You're up, Leah.
Wonderful. Hello, everyone. I am excited and humbled to be sharing time with you all, especially so many CCDF, tribal, and state agency staff. I know your jobs are busy and demanding, and I so appreciate you opting to be here today. I hope I can help make it worth your while. I will be presenting from our study using a natural experiment to preview subsidized childcare reform's impact on subsidy stability and continuity of care in Illinois. And this is joint work with my colleagues, Robert Gerga and Michelle Carter. Next slide, please. So to give an overview of our study here, so we're taking advantage of extended program eligibility occurring in 2014 as an opportunity to preview policy change in the Illinois Child Care Assistance Program, or CCAP. So I'll start by setting the stage. Before October 2018 in Illinois, families received subsidized childcare, or CCAP, in 6-month intervals. So they must reapply every 6 months to maintain eligibility. And I think at the time, as Julia said, kind of in the kickoff for the webinar, about 24 other states at that time had a similar policy. So this 2014 data system change led to some families getting an additional 6 months of eligibility automatically without having to submit new paperwork. So we had an end result that was a significant number of families getting 12 months of continuous program eligibility that wouldn't have otherwise happened in Illinois. But not all families in 2014 got the automatic eligibility extensions. It varied by their region within the state and the month that families came due for reapplication. And so we used that variation for our study. Next slide. So here's an overview of what we did. We used data from the statewide Child Care Assistance Program, administrative data from Illinois between 2011 and 2020. We also used data from the American Community Survey to include census tract characteristics in some of our analyses. Our study sample is broken into 2 groups: extended eligibility families who received at least those 12 months of eligibility, and that's represented by 42,800 households and 69,000 children. And what I'm calling our standard eligibility families, so the families that just got the process, the typical process that was happening in Illinois at that time, and they were subject to a 6-month eligibility period, and that's 15,700 families and 26,000 children. And so for methods, we're comparing the length of time using the Child Care Subsidy Program between the extended eligibility families and the standard eligibility families. And like the other states, we also conducted duration analysis. Next slide, please. So that leads to our research question, which is, does extending the child care subsidy eligibility period in Illinois from 6 months to 12 months increase stability of subsidy receipt, or kind of length of time on the program, and continuity of care? And as you'll see, we're defining continuity of care as the time that children are spending with a particular primary provider. Next slide. All right, so here we go. Here's the first graph. So let's dive into the results. This is showing that extended eligibility resulted in more months using the child care subsidy and more months with the primary provider. So starting on the left side of the graph, you can see the median spell length, or kind of the time that families were continuously participating in the program. For child care subsidy was 9 months for the standard eligibility families, shown in the maroon bar, and 14 months for the extended eligibility families, shown in the blue bar. And then moving to the right side of the graph, we're looking at within that time in the child care subsidy program, time with that child's particular primary provider. And here the median spell length was 5 months for the standard eligibility families and 11 months for the extended eligibility families. So a noticeable difference there. Next slide, please. So this type of figure presenting a duration analysis should look familiar by now, since we saw something similar presented by both Oregon and Massachusetts. This graph is showing how many months children stay with their primary provider in the child care subsidy program. So that maroon curve is the standard eligibility families, and the blue curve is the extended eligibility families. So up at the top of the chart, 100% of them are starting with their primary provider at the beginning. And by about month 7, 50% of the standard eligibility families have left their primary provider, but it's not until month 12 that 50% of the extended eligibility families have left their primary provider. So in summary, this is another way of showing that families who received the extended eligibility spent more time with the child's primary provider than families who went through the standard eligibility process, which again was 6 months in Illinois at this time. And just adding a technical note for those of you who may be interested, these results are based on a Cox regression model that includes controls for child age and census tract characteristics, race, ethnicity, employment, education, transportation, and income to poverty ratio. All right, next slide. All right, so back to bar graphs. We're also interested in understanding whether there were different findings based on the type of provider. So this one is showing that extended eligibility resulted in more months with the child's primary provider for both home-based providers and center-based providers. So starting on the left, the median or middle spell length in home-based providers was 6 months for standard eligibility families and 11 months for extended eligibility families. And moving to the bars on the right, the median spell length in center-based programs was 5 months for standard eligibility families and 9 months for the extended eligibility families. And it's not shown, but we also examined whether there were different findings based on child age, and we didn't see anything there. Things were very similar across children birth to 2, 3 to 5, and 6 to 12. Next slide, please. Okay, this is the last chart. So hope everyone is hanging with me and can handle one more. It's a little different. So I'll explain what's going on. So this graph kind of zooms out a bit and it looks at the total number of children served by the Illinois Child Care Subsidy Program between January 2011 and January 2020. And the vertical dotted lines, and I'll highlight those in a moment, show the 2 time periods between 2011 and 2020 where eligibility for the subsidy program was 12 months for at least a majority of the families. Next slide. So here the blue box is showing the time period in 2014 where due to this data system change, many families were functionally offered a 12-month eligibility period, even though it was due to these data system issues rather than a planned policy change. You can see the monthly caseload of participating children increased from about 150,000 in January of 2014 to 180,000 in December of 2014, which represents a peak caseload for the program between 2011 and 2020. Next slide. So now we fast forward in time to October of 2018, which is when Illinois implemented the 12-month eligibility policy for all participating families. And the monthly caseload of participating children increases from about 125,000 in October of 2018 to 140,000 in September 2019 before starting to decline. So there are, probably as most of you are aware, there are really a number of dynamic factors that can influence subsidy caseloads, such as the state of the economy, the population of young children in a state, the supply of childcare. So we can't paint a clear story of cause and effect, but we do see that the number of children served by the Child Care Subsidy Program is increasing during periods with extended eligibility. Next slide. So a summary of findings from the Illinois study extending the subsidy eligibility period in 2014 led to a 5-month increase in the median or middle value of the amount of time in the Child Care Subsidy Program and a 6-month increase in the median amount of time that children spent with the primary provider. Stated in days, it was a 52-day increase in the number of full-time days with the primary provider and a 7-day increase in part-time days with the primary provider. We also did some 5-day analysis. So I didn't do in detail here, but offering that stat now. And in summary, the number of children served by Illinois increases during periods with extended eligibility. Next slide. So ending with a few implications, 12-month eligibility periods implemented in Illinois and other states in recent years could result in longer childcare subsidy spells for families and children spending more time with the primary provider. With families staying in the program longer, there may not be enough supply of subsidized childcare to meet demand. And as many are aware, there are big unanswered questions around the impacts of extended eligibility in the current subsidized childcare landscape that's still in recovery from the impacts of COVID-19. Next slide. So very much welcome your questions. Please drop them into chat. I look forward to the discussion section. And I'll acknowledge our partners. Does this sound familiar to anyone? This project is supported by the Administration for Children and Families of the United States Department of Health and Human Services as part of a financial assistance grant, number 90YE020, totaling $981,000 with 100% funded by ACF HHS. The contents are those of the authors and do not represent the official views of nor the endorsement by ACF or HHS or the US government. For more information, please visit the ACF website, Administrative and National Policy Requirements. And this study uses data from the Division of Early Childhood, Illinois Department of Human Services. Its contents are solely the responsibility of the authors and do not necessarily represent the official views of the Illinois Department of Human Services. All right. Thanks, everyone.
Thank you, Leah. I see one question already, but I want to encourage people to put follow-up questions. You've given us a lot to think about. Not only the subsidy spell length, but the time with the provider, and then those rising caseloads that accompany the extended eligibility. Let me ask this question. In the duration analysis, you're looking at the time the children spent with the provider. Am I right in thinking that there were steeper drops in each group around the time that the recertification would have happened, like at the 6-month mark or at the 12-month mark?
Yes, that's right. And that's what we see. Because for the duration analysis, we line everyone up at their start month, like a month 1 or 0, not kind of chronological time. So those drops, the kind of steep jumps that you see at 6 months, 12 months, and 18 months are because all the families were coming due, especially in the standard eligibility, were coming due for reapplication at those time periods. And that's a big drop point for families.
Ivy, why don't you take the slides down as we start moving into our discussion period? I guess I'd like to start with a round of appreciation for our presenters. Thank you so much for sharing what you've learned in these studies, which I know are still ongoing, that sometimes it's hard to share findings before you have complete published reports. And of course, if you had published reports, people would love to see the links to those in the chat. I did see a question in the chat for, what happened to my chat? I don't know how that happens in Zoom. Hang on one second. Well, while I'm looking for the question, keep your questions going. Question for Kate. What is the difference in support provided to TANF versus non-TANF families? And Kate, I saw you replied in the chat. There also was a question about just clarifying that 12-week and 12-month.
Yeah, I'll clarify that again in case anyone missed it in the chat. But there was a great question just about Region 1 issuing 12-week authorizations. And again, they issue 12-week authorizations for families who just entered the cash assistance program who are not yet employed or not yet in a work training program. And they'd get a 12-month until they became employed or were in a work activity, and then they would be issued a 12-month authorization. So it wasn't that Region 1 was just issuing 12-week authorizations and not the 12-month. They were doing those in addition to. So just a quick clarification there. And then the question about support for non-TANF families, I guess I'd want a little more about how you define support, but maybe this is helpful for low-income working clients in Massachusetts. They, of course, would go just directly to the CCR&R office to get their vouchers issued and renewed. Again, they obviously are not connected to the TANF office, so they don't have that kind of second step to go. And at that stage, they would receive similar to support as the TANF families once they're at the CCR&R office, if that makes sense. The same voucher counselors see in all the CCRs, both TANF families and low-income working families. So there's no difference at that stage, if that's at all helpful. But I'd love clarification on what you are looking for in terms of support. As Julia said in the introduction, Massachusetts has had a 12-month authorization period for our low-income working families for a long time now. So if hopefully that's helpful too.
Okay, I'm seeing great questions in the chat, which is great. Let me, and we thank our presenters, that's great. I was going to invite, and then we'll come back to discussions, but I just wanted to give Chris an opportunity to provide your reactions. And I know that Leah started to give policy implications, and I also don't know if you had policy thoughts after hearing this.
Yeah, I mean, as a state administrator, I really value the time to learn from and alongside our research partners. The Early Learning Division's relationship with Oregon State University and Megan as a research institution has given us many opportunities to learn from the quantitative and qualitative lens about the subsidy caseload and subsidy provider pool. OSU's research on subsidy spell length really opened up the conversation in the division and with advocates on how 12-month eligibility alone does not have a huge impact on childcare stability in the subsidy program. And this research data was really just the beginning framework to inform the story around CCDBG reauthorization and how it's implemented. So there are a few things that we've done on a policy level in the last few years with this research. In 2020, OSU conducted additional qualitative analysis on the subsidy program for a special child care task force that was created by the state legislature and used the data to highlight how difficult it is for a family to find a provider who's willing to take a voucher and provides care at the time that they need it. At any given time, we have around 18% of the caseload that cannot find a provider within the 3 months of being determined eligible, even within that 12-month eligibility period. We also heard from providers about the barriers they see in participating in the subsidy program, especially some of the administrative burdens. And providers expressed that it might be difficult to balance program budgets given the limited hours that a family is approved for in the subsidy program. So that allowed us to see what kind of floor and different policies around enrollment and provider payment we could address. And then the task force then used this research to create a report and framework for action to move forward to improve the subsidy program, which included the creation of a new agency for early learning. So we will have a new agency called the Department of Early Learning and Care in Oregon, and the transition from the subsidy program from the Oregon Department of Human Services to the new agency so that the lead agency itself will also be in the same agency as our subsidy program. Also in 2020, we started to build out our internal research capabilities, and Oregon State University really serves as a great partner to help align the research on the subsidy program with other research projects that we have with other learning and care programs. And last year, the Oregon legislature passed legislation to allow us to adapt more program policy changes around family eligibility that fit within the flexibilities for states in our CCDF state plan. We're really hopeful on a policy level that these changes and the adoption of an alternative rate methodology for childcare rate setting will interact with the 12-month eligibility period to increase the length of stability of subsidy spells and really increase that stability for children and families.
Thanks, Chris. I was going to post the slide asking you all to ask questions, but they're coming fast and furious, so let's skip that slide. I also was letting you know that you can unmute yourself, and I do see, unmute yourself. You raise your hand, we can unmute you. I did see someone raise their hand a while ago. Mary, Erwin, can you unmute her? Ivy?
I didn't mean to do that. I'm sorry.
Okay, that's okay, Mary. We will go on to, but that shows that if someone wants to speak out loud, just raise your hand and we will call on you. I'm going to take some questions from the chat while I'm waiting to see if there's other raised hands. This is a question for any of you. In all 3 states, similar patterns were found, but the numbers of increasing are different. Do you think the new policy caused the same impact to all states or different impacts, and why? So yeah, we saw everyone had their median spell go up, but it went up much more in Massachusetts than in Oregon, but I guess Illinois being in the middle. Does anyone want to hypothesize why?
It's something I've wondered a lot about as I have had the opportunity to see the results of, you know, my Massachusetts and Oregon colleagues, I don't have a good answer. One thing that comes to my mind, and curious to others' reactions, is there's so many factors that determine caseloads, but one seems like how easy the reapplication process would go into how much a benefit it would be, like how much it would smooth things out to take it away at a 6-month interval. But I don't know, there's a lot of things that in the implementation that makes it different. I would really be interested to see in the chat if any of the agency folks have ideas too.
And that's Leah, that's great. I absolutely agree. One of the hypotheses that I've always thought of in terms of differences in states, in terms of getting reauthorized, is whether or not your state also has a wait list, a subsidy wait list. At least in Massachusetts, we have a long wait list, and we've heard from a lot of parents, I'm going to do whatever it takes to get reauthorized. And so there's a really strong motivation to not have to get back onto that wait list. And so families will get reauthorized. And I think generally speaking, that's why the state tends to have longer spell lengths just in general, because there's this fear of having to go back on a long wait list, especially when families have already experienced that before. So I think I'm not sure. I'm not remembering if Illinois and Oregon have a wait list or not. But that's one hypothesis I've had in the past too, that could be a driver for families on making sure you get reauthorized on time and you don't see a break in that subsidy spell or subsidy receipt.
Oregon has the capability for having a reservation list. It is not currently active.
Thanks, Chris.
So here's a question for the participants more than for the panelists. Are there any states considering extending eligibility beyond 12 months if funding permits? I mean, the panelists could answer, but I think we have a lot of different states and tribes represented here. If anyone wanted to say if they are aware of other states or themselves considering longer than 12-month eligibility. And while people are thinking about that question, here's a question for Leah. This is from Catherine Miller, and I could say people can say them out loud, but I'll read it for now. Apologies if she missed this, but have you looked at or planned to look at, you talked about the length of spells in home and center-based. Have you looked at the relationship between provider characteristics and length of spells beyond the home and center-based ones? Have you looked at other characteristics looking at the length of spells for different providers?
Yeah, the other one that we looked at was licensed versus license exempt, which is not completely the same as home versus center, right? Because there's kind of licensed and unlicensed in both. We didn't see huge patterns there either. It tentatively looked like it might have helped the license exempt families have continuity a bit more than the licensed, but that's the other one that we're looking at.
And I see thank you, Leah. I appreciate that. I'm also seeing an answer from Mary Ellen that during the pandemic, they extended eligibility by 3 months. So instead of 12 months, it was 15 months. I'm sure you weren't the only one from New Mexico, you weren't the only one who extended eligibility during the pandemic. Most of this research was done before the pandemic, and you heard how in Massachusetts, you have to follow families a long time if you want to see how long they stay on. You have to follow them until they leave. And with the pandemic and all the administrative data changes, then it was hard for Massachusetts to follow it long enough to get to a median. Let me look both at my clock and any other questions. Kate, did you look at the 12-week and the 12-month authorization separately so that if people got a 12-month authorization in Region 1, were they similar to Region 2?
Oh, interesting. I'm going to actually defer to Yunsuk Ha, who is on the Q&A panel as well. I don't know if that's actually a great question. If we looked at individuals who got a 12-week, I think that's what the question is asking, versus those that just got 12 months or got a 12-week plus the 12-month. I don't know if we looked at that, but I think that could be really interesting. Yunsuk, did we do that?
Oh, sorry, can you hear me?
Yes.
Yes, we can hear you.
Sorry. So we didn't look at those subgroups. So we just look at the demographics of participant in reason 1 and reason 2. So overall, reason 1 had was had more diverse. It's a race. Their participant was more diverse in terms of race, and then reason 2 was more a high percentage of participant in reason 2 was Hispanic and Latinx. So it's about 80%. So there are just some differences in racial background, but other than that, we haven't done any kind of subgroup. We didn't compare their characteristics in terms of those subgroups.
That's a great question, though. I think that'd be really interesting to explore. So thank you for that.
And thanks for jumping on, Yunsuk. We have, as you can tell, there are co-authors that have joined to help answer questions. I know Bobby Weber answered one of the questions about the 801 data. I don't see other questions. Oh, here's a good question. In Illinois, time spent with the same primary provider was mentioned. From a human development point of view, yeah, it's important that children stay with the same teacher because that's better for attachment reasons. If the 12-month policy increases the time spent with the same provider, it would be really interesting. Wouldn't it be interesting to look at the socio-emotional development outcomes later? Anyone like to comment on that? How the whole, taking a step back, I mean, subsidy spells are important for many reasons, but more time spent with the provider, do you think we'll see something on socio-emotional developmental outcomes?
Yeah, I'm glad this was raised, and it's something we've thought a little bit about in Illinois. I was thinking about like what we can do with the data first. The trick for us is in the centers, then we can't observe teacher, right? So like a larger center, we just know that the child stayed with that center. We can't observe if they moved between classrooms, if their primary teacher, left and they got a new teacher. But a lot of the Illinois caseload is in smaller home-based settings or in these licensed exempt providers. And in those families, which is a lot of our caseload, the continuity that we see with the provider is with an individual. And so they would be staying, there is the potential for that kind of the relationship development part to be observed. I don't know what that means for our analysis, but I agree that it's interesting. And so thank you for raising it.
I see another question about the slides. So we will be, actually, maybe that's my cue to go to the resources slide. Why don't I pull that up? Because people want to get your slides. We need to go through sort of like a clearance process. So it may take us a little while, but we will be posting the slides, the whole recording, and the transcript of this webinar on the OPRE website. And we also will be posting the slides on our Building Childcare Research Capacity webpage. And we will send an email alert to everyone who registered. So if you attended or didn't attend, I think you'll get those. The other thing I want to let you know is that we're having a second webinar, April 20th, also on a Wednesday. So coming up 4 weeks from today, Measuring and Supporting Child-Teacher Interactions, a State and Tribal Story. And that will also be, well, depending what time zone you're in, on the Eastern time zone, 1 to 2:15. And that will be a chance to hear state and tribal perspectives on measuring and supporting child-teacher interactions and culturally responsive practices in childcare programs. It will feature program staff and researchers from 2 more of the CCDBG Implementation Research and Evaluation grantees. Those will be from Georgia and the Cook Inlet Tribal Council. And I see that Laura has put those websites in the chat, and she's also put the registration. If you haven't yet registered for that webinar, please do. And if you have questions, you can email me, Julia Isaacs, at JISAACS@urban.org. I saw there was a question in the chat, which I think it's too late to go to. Hopefully somebody can answer it, you know, if it is there. We are going to ask you to just we're going to ask you to give us some feedback on the webinar. We have 2 short poll questions. Will you pull those up? But as you do, just thank you so much to the presenters. Thank you. This was, one of the presenters said this was a lot of preparation because we did rehearse it quite a bit, but we wanted to make sure it was good because there's so many of you listening. And thanks everyone for coming, and please answer our poll questions because we will be repeating these webinars and we want to you know, build on the experience of each one. Thanks everyone. We won't close out right away. We'll let you, we'll let you fill out the poll, and then have a good rest of your Wednesday and a good rest of your week. And our panelists, you can stay on to read all the thanks to you. But then thank you again so much for everything. And I think this ends our webinar. Thank you.